Hi, so I am back from the hospital. I went today to the day surgery unit. I didn't have a surgery, I had a small procedure. I got my surgical feeding tube changed over. My feeding tube is in a balloon tube like many others. It has a circular disc that keeps it inside my body, so they need to pull very hard to get it out. And because it goes only into my jejunum, my small intestines, rather than my stomach, it always gets changed in hospital anyway. So this is just a bit of a video for some tips and tricks of things that I have found really helpful. They could be relevant for other people going in for other procedures, but this is just things that I found really helpful this time around. So first things first, comfortable clothing and also baggy clothing. So because there is a little bit of trauma with them having to pull the tube out and feed a guide wire into the stoma and things, my abdomen does tend to get a little bit bloated. So I ensure that I have baggy clothing that is also comfortable and things like that. So that worked really well for me. I did have to wear a hospital gown, but I did some things to make myself a little bit more comfortable. So fluffy socks, my feet are always cold, and also I don't always like walking about on hospital floors in bare feet. This is a non-underwired bra. I got to keep it on during my procedure and it just was so much comfier than having an underwire digging into me. And also I do find that if I am in a little bit of discomfort, it can help not having an underwire bra on. And to keep my dignity, I took a pair of big kind of baggy pajama shorts with me, and again I was allowed to keep them on. So on to other things. In terms of pain relief and things like that, check with whoever's done your procedure, your surgery, just to double check you are okay to use these. These can be used in conjunction with other pain relief, but this is amazing. This is actually what's called a menstrual belt, but it's great for any type of abdominal pain really that you find is helped by heat. It's USB chargeable and it's a heat pack, but it also has some vibration settings, which admittedly I didn't use the vibration, but the heat definitely helped. It's different temperatures, works really great. Got it off Amazon. If you've not got one of these are also an option. These are the room air activated heat pads that you stick to your skin. If you think you'd more prefer cold, I took this deep freeze glide on gel roller and this worked really quite well. So I took one of my anti-sicknesses with me just because the form the hospitals don't typically have in my experience. I would recommend taking any more unusual medications with you as well. I didn't know if I was having sedation or not, so I did take my Ventolin inhaler with my spacer just because due to being asthmatic, sometimes the sedation can make me a little bit tight-chested and I find the spacer works a lot better. Because I crush my medications to put them through my feeding tube, I decided to take my little mortar and pestle, which I got off Amazon. I do have a pill crusher, but it's in a different box. I also took some syringes as well, just because in my experience, a lot of places in the hospital that aren't gastroenterology don't have syringes to fit feeding tubes. So I took them with me. I did have open ones, which I did use. I took some baby wipes, it was nice to freshen up a little bit after I had it done, and just some roll-on and spray deodorant. Because I am sick a lot, my dentist advised me not to brush my teeth straight afterwards. So I always carry about this little travel bottle size of mouthwash, and it's just worked really well with me. I did take a toothbrush and some toothpaste with me as well. Some tissues, these were great because it meant that I could just give around my site a bit of a wipe once I got back to kind of the day surgery unit, just because there was a bit of leakage and I also took just some lip balms, some Carmex, just because my lips do get quite dry, particularly this time of year. I took a phone charger with me. Number one tip, very long cable. I think this is like a 3-meter one or a 2-meter one, because the plug sockets on some hospital beds are like the opposite side of where you are. This is amazing as well. This is my portable charger, got it off Amazon. It's the brand Charmast. It honestly has worked so well, and I took a bit of a smaller cable with me. I took headphones from my phone just as I was in a bay with other ladies. Didn't want to disturb them, particularly if people have had anaesthetic or sedation. For entertainment, I took my Switch and some headphones for it, and this is actually a case for all my games, so I don't need to carry about the actual boxes. It was cute, it was off Amazon, it wasn't that expensive. And finally, I also took some books with me. I didn't actually get around to reading them, I just played on my Switch. But yeah, I just thought I'd make this video as I think it might help some people. And if you are going for a procedure or a surgery, I hope it goes well. And if you'd like to ask anything at all, feel free to ask me and I'll happily answer if I can.